Start recording. Perfect. Okay, so welcome to pathophysiology, and chapter number one is, of course, introduction to pathophysiology, base framework for pathophysiology based on common or classic presentation of disease in the physiology function of human being. Of course, we are going to be talking about human beings. Also, my background is in medicine. I'm a doctor in medicine, so everything that we are gonna be talking right here is medicine. Okay, you are gonna be a nurse, all of you, and you are gonna be in hospital facing patients, dealing with doctors. So you have to know medicine, and medicine is the same for doctors, for nurses, for everybody that is inside hospital. Okay. So pathophysiology basically is the physiology of the disease. Okay. Interrelated topic in pathophysiology, we have etiology, we have pathogenesis, clinical manifestation, and of course the treatment. In this class, we are gonna touch a little bit about treatment. We are not gonna go in details, but you have to know, to have an idea what are the medication that we use for this disease. Okay, it's like broad. Okay, it's in general. It's not really specific. Okay, etiology is the study of causes or reason for phenomena. Phenomena is the disease. Okay, so the causes or reason that you develop the disease, that's the etiology. Okay, then we identify some factors. That's why most of the time when you have a disease, we have risk factor for the disease. Okay, for example, for myocardial infarction, risk factor for myocardial infarction, then we have a lot of risk factors like obesity, hypertension, gender, because male are more at risk to develop myocardial infarction than female, age, of course, and other comorbidities that are related to myocardial infarction. That's to give you an example. Okay? Etiology, we have classification of the etiology, of course. We have idiopathic, and iatrogenic. Those are the two most common. Idiopathic, why? Because when you say idiopathic is that we don't know the cause, okay? And then the classification is idiopathic. Iatrogenic is when you provoke the disease, okay? For example, sometimes you give a treatment to the patient, and that treatment, one of the side effects is that produce another condition that then is iatrogenic. Okay, for example, Cushing disease. Cushing disease is a problem in the adrenal glands that the people get really fast. They have a moon face, that is the face really like round. They have the buffalo horns, that is the back of the neck full of fat. And most of the time that disease is iatrogenic. Why? Because it's produced as a side effect of uh, steroids. Okay, when the patient use steroids and they get rid of the steroid out of the solens, they develop the they are at risk to develop Cushing disease. And if you develop the disease, it's because iatrogenic, because it's produced by doctors. Okay. Also, we have risk factor, and let's keep going. Pathogenesis is how you develop the disease. Okay, that's the pathogenesis. Okay, basically, it's the embryology of the disease. Is how you how you develop, exactly how you develop the disease. Now we have clinical manifestation. Clinical manifestation are extremely important because that is the one that is gonna give you the idea what is going on with the patients. Okay, and you always gonna hear signs and symptoms. Okay, because that gives you an idea. Is the patient come to the emergency room and the patient have chest pain, that is like pressure light, that is radiating to the neck and to the left arm, maybe have high blood pressure, is sweating, then you have an idea that maybe it's related with the heart. Okay, why? Because the sign and symptom. Then you, based on those signs and symptoms, is what you are gonna do to the patient. Okay, your next step. What is your next step? If you have problem in the heart, you do an EKG and cardiac enzyme. Then you rule out heart problem, and if everything is normal, then you go to the next step, and you have to do more question, more interview with the patient to uh, find out what is the problem with that patient. Also, we have a syndrome. Syndrome is when you have it's basically a disease that have a lot of manifestation. Okay, it's not basically, for example, Down syndrome. Down syndrome, I'm putting Down syndrome because I'm pretty sure that is the one that everybody have an idea. Down syndrome is not only one disease, okay? It's a couple of diseases that is produced by one genetic alterations, okay? And Down syndrome, they have intellectual disability, they have problem in the heart, they have problem sometimes in the kidney. So there is a lot of manifestation, and you group all those manifestation because it's produced by the same pathogenesis. Okay. Now we have question number one. And question number one, let's see. Which of the following is an example of the clinical manifestation known as a sign?
B.
B. Exactly. Listen, sign is something that you could see, okay? Symptoms is more like suggestive, okay? Like nausea, because you don't see the nausea. The patient is the one that is gonna tell you, and I have nausea, okay? Headache, sign is always measurement. You could measure the sign, you could see the sign, okay? In the symptoms, you have to make like some scales, but it's really hard to measure. Okay, headache, if you work in hospital, because I know most of you sometimes work in hospital. We have on a scale, and it's a subjective scale that you say to the patient, okay, you have headache, okay, from 1 to 10, 1 being the least and 10 being the worst. How do you classify your headache? And then the patient is going to say, I'm in a 7, I'm in an 8, I'm in a 10, 11, but it's not something that we could measure like fever. Okay, fever is no, how do you think that you have fever? No, you put a thermometer, you have 37. Okay, if you think that you have 40, sorry, but it's 37. Okay, let's keep going. Now we have stages and clinical course. Okay, listen, you have to know this because I'm pretty sure that you have questions on your test from this slide. Okay, we have latent period. Latent period is time between exposure of tissue to injuries, aging, and the first appearance of signs. And we have prodromal period is the time during which first signs and symptoms appear indicating onset of diseases. We have acute phase, disease will reach its full intensity. So latent period is, for example, the patient is exposed to a viral infection, and most of the time you heard that virus have an incubation period. That incubation period is the latent period. Okay, it's a period that you already have the disease, but you don't have any sign and symptom. Okay, prodromal is that you develop the sign and symptom. Okay, that's the prodromal period. Is when you start developing sign and symptom of the disease. Okay. And the acute phase is when you have the full flare of all the signs and symptoms of the disease. Okay. Okay, we have the same subclinical latent period is the same is the period that you don't have any sign and symptom, but you have the disease. That's why sometimes you hear in HIV that patient isn't latent because HIV have sometimes a latent, sometimes not have a latent period, and latent period is really common in viral infection. Okay. Because there is a lot of viruses that have like incubation period, and that is related to the latent period. So clinical stage is when you don't have, you see, patient function normally, disease process are well established. So subclinical is that the patient have the disease but also have some sign and symptom, but the patient could work normally. The function of the patient is normally, okay? That's why it's subclinical, because the patient doesn't have the full blown of the disease, okay? Acute clinical first, chronic clinical, okay? Acute is when some disease is really fast, okay? Like you have myocardial infarction. Myocardial infarction is always an acute condition, okay? It's always an acute condition because you develop myocardial infarction, yeah, just in couple of hours, okay? And you don't treat the patient is gonna die like in the next couple of hours. That's why it's an acute condition, okay? Chronic condition could be like hypertension, that you have hypertension and you could be without treatment for a lot of time, but you have hypertension. Diabetes is another chronic condition that you have diabetes. The statistics show that patient with diabetes type 2, the onset that you diagnose the patient is not the first day of the disease. The statistics show that those patients, they have the disease 5 years ago because it's a chronic conditions. The patient has some manifestation, but they could work normally, and that's why it become chronic. And it's also chronic because basically you don't have cure for that condition. Okay, you have treatment for the condition, but you don't cure the condition. Stage we have exacerbation, remission, convalescence, and sequel. Okay. Exacerbation is like worse of the condition. Okay, you have a patient with any conditions, like for example, you have a patient with hypertension and the patient is on treatment, but one day the patient get better. It's an exacerbation of the condition. Okay. Now remissions is, this terminology is used a lot in tumors, in cancer. Okay. You have the patient, you treat the patient now, according to the lab, everything is under control. Basically, you cure the patient, but we don't say that the patient is cured. We say that the patient is in remission, and then you have to keep a follow-up with that patient. Okay? For example, in the case of cancer, we have tumor markers. Okay, if you are treating a patient, you follow the tumor marker. The tumor marker goes to the normal levels that is in a normal persons. Then you say the patient is in remission. Then you just follow up with the tumor marker. Convalescence is a stage of recovery after a disease, injury, or surgical procedure. So after you have a surgery, then you have a period that you are convalescence, that you are recovering from the disease. Okay. And sequels is when you have some problem after you have a disease. For example, if you have a stroke, sometimes one of the sequel could be that you have motor deficits in the leg or motor deficits in the arm for the rest of your life. That's a sequel of the previous condition. Okay.
Professor,
Yes. Well,
going back to the remission, you said that the tumor markers, that's basically the same levels as a healthy person. Is that what you're saying?
yes, exactly.
Okay.
Everybody know what is a tumor marker? I think we covered tumor marker later on in the class, but tumor marker basically is like some cells, some indicators that we have in our body that are linked to one neoplasia, linked to one cancer. Okay. Like for example, if you have pancreatic cancer, you are gonna follow the CA 199. There is most of the time they have numbers. It's according to the neoplasia. Okay, treatment implication, understanding the etiology, pathogenesis, and clinical consequence of a particular disorder, disease, illness may determine which treatment could be helpful. Most pathophysiology textbooks focus on general treatment. That's why we are going to be covering general treatment. Okay, if we have, like for example, some infectious disease, what is the treatment? Antibiotic. Okay, we are not going to be in details what is the specific antibiotic that we use. For example, if you have an infection with gram-negative, if you have an infection with anaerobic bacteria, we are not going to go in those details. It's just general. Statistical normality, a stage of disease in a normal population based on the bell-shaped curve. Reliability is ability to give the same result in repeated measurements. Validity, predictive value. Validity is the degree to which a measurement reflects the true value of what it intends to measure. Predictive value is the extent to which a test can differentiate between present or absent of a present conditions. Predictive value, all these terminology are statistic. You have to read here from the PowerPoint. I'm not gonna go in details. Are those uh, concepts sometimes are extremely complicated. For example, predictive value, we have positive predictive value and negative predictive value. That's a statistic. I'm not gonna go in details. Sensitivity and specificity is the same sensitivity. Most of the time, this case, sensitivity and specificity, we use for example, for a test. For example, now we have a vaccine, and that vaccine have a sensitivity and a specificity. I mean, not for vaccine, it's for test. You see that the test that we use for the COVID, that test have an sensitivity and a specificity. And sensitivity is the probability that the test will be positive when applied to a person with a particular condition, and specificity is the probability that the test will be negative when applied to a person without a particular condition. Okay, listen, in other words, when you have, most of the time, it's not in all diseases, but most of the time when you make a test, the first test that you are going to use, always the best for the first test is the sensitivity. Okay, if the test have a high sensitivity, you use that one, sensitivity. Okay, and then a specificity is basically a specificity, is a specific for that test. So if you are positive for a sensitive test, then you have to perform the specific test. If you are positive for the specific test, that means that you have the disease. Okay, but then HIV used to have a sensitivity and a specific, but now they change it. It was the Western blot, and I don't remember the other one. Individual factors, cultural considerations is culture. Listen, culture factor is a huge risk factor for a lot of diseases. I'm gonna give you just one sample. For example, in China and in Asia they used to eat a lot of food with preservatives. So food that are in cans, that use a lot of chemicals. That's why when you go to Asia, one of the biggest neoplasia in Asia is stomach cancer. Why? Because of the culture, because what they eat. Then you come here to the United States is different than the stomach cancer. The prevalence of stomach cancer is not so high here in the United States. It's different. Of course, we have a lot of diseases that is according to the age and also according to the gender. Other factors, situational difference, time variations, those are other factors that predispose a patient to develop the disease. Okay? Concept of epidemiology. Epidemiology is basically the statistic of any disease, okay? And that statistic is you apply that statistic to a specific population or a specific group of people, and that give you medicine. Everything is based on epidemiology and statistic, okay? When in medicine we say this is the most possible disease is this, is because that is based in a previous statistic, okay? For example, you have an stroke, the most common stroke is ischemic. Why? Because the statistics show that most of the people that have a stroke is ischemic, okay? Now we have this terminology. Listen, also this terminology is extremely important because you are gonna have a question in your test. Okay, endemic means that is natural in one specific place. Okay, for example, I'm gonna give you an example. Malaria. Malaria is a disease that is endemic to Cuba, Dominican Republic. Okay, it's endemic in that area. Okay, now epidemic is when you have an outbreak in one specific area. Okay, I'm gonna give you this sample. COVID-19. COVID, when the COVID started in China, at the beginning was an epidemic because was an outbreak of the same disease in one specific region of the world. Now that disease spread to the whole world. Now it's a pandemic. Okay? Let's keep going. That is clear. You have to be clear in this one because I'm 100% sure that you have a question on those concepts right there, okay? Now, aggregated factor of epidemiology variable. We have age, ethnic group, gender, socioeconomic status. Sometimes you don't think that is important, but it's extremely important. Okay, there are some diseases that are particular to one population due to their socioeconomic status. Okay, geographic location, of course. And we have question number 2. Okay, let's go. In question number 2, which of the following is an example of a factor that will affect the epidemiology of a particular disease?
B.
Exactly. That's a specific area, Southeast Asia. Ethnicity. That's a specific ethnicity with a specific location. Okay. Predictive value, that's a statistic. Circadian rhythm is not related with this. That you rule out that one automatically. Clinical manifestation is sign and symptom. Level of prevention. Level of prevention, also you have equation in this. Okay, we have primary, secondary, and tertiary, and sometimes we also refer to quaternary. Okay, the primary is altering susceptibility or reducing exposure for susceptible person. Secondary is early detection, screening, and management of diseases, and tertiary is rehabilitation, support care, reducing disability, and restoring infected functioning. Okay, primary is prevention. Okay, what is the prevention? That you have to use the mask for COVID-19. Secondary is screening. What is the screening? You do the test, and the tertiary, the vaccine. Okay, right there you have the sample of those three. And we have question number 3, and let's go. Okay, which of the following is an example of primary prevention?
A.
Exactly, A. Maintain routine immunization. That's the primary prevention. Done? Any question? Okay, let's do the chapter number 2. Let me see. Where is chapter number 2? Right here. Okay, listen, always when I said this is extremely important is because I remember from one of your questions. So every time that I say this is extremely important, you have to mark that slide and then you have to review really, in details that slide. Okay. And from the previous chapter, your primary, secondary, tertiary, I'm pretty sure that you're gonna have a question, and it's gonna be like that. It's gonna give you an example, and then you have to say it's primary, secondary, or tertiary. In the epidemic, pandemic, the same. It's gonna give you like an example, and then you have to say it's epidemic, pandemic, or endemic. Okay? But the same again, if you have any question when you are studying during the week, just send me a message and I answer your question. Now let's go to chapter number 2. Chapter number 2, we are gonna be covering homeostasis, allostasis, and adaptive response to a stressor.
Professor, I'm sorry to interrupt. You said in the previous chapter also to pay close attention to the stages, correct? The latent period, prodromal period.
Yes, exactly, because those are terminology that are easy to make equation. I'm pretty sure that you have question from those concepts in your test. You have to know also those concepts.
Okay,
Okay,
thank you.
you're welcome. Now we have homeostasis. What is homeostasis? Listen, basically, in another word, homeostasis is a balance. Okay, it's a balance and or equilibrium in your body. Okay, in your health. That's homeostasis. Okay? Allostasis is like the next step of homeostasis. Okay, homeostasis basically, let's put it that is a basic level of balance in your body. Okay, allostasis is the ability of your body under a lot of stressor to maintain homeostasis. That's basically the main difference. Okay. Stress. What is a stress? A stress is anything that produces a change in your body. Okay, it could be physical, chemical, emotional, actual physical, mental state that tension produces, real or perceived threat to homeostasis, direct, uh, consciously or indirect, consciously sense threat to the stability of the organ. So anything that produces change in your body is an stress, okay? And also we have a stress in our life, and stress is good, okay? It's not bad, okay? When you handle the stress, when you have the ability to handle the stress, we need a stress in your life. When you can handle the stress, then you make unbalance in your body, and then you develop the disease, okay? Now we have general adaptation syndrome. We have three stages. We have alarm, resistant adaptation, and exhaustion. We have the alarm stage is the fight or flight response as the result of a stressful stimulus. Okay, it's a hypothalamic pituitary adrenal axis. That's hypothalamic because all those are big glands that we have in our body, and they communicate between each other. Okay? We have resistance or adaptation activity of the nervous and endocrine system in returning to the body to homeostasis. Allostasis states activity of various systems attending to respond homeostasis. Remember that allostasis is basically the next level of homeostasis, okay? Homeostasis is a basic equilibrium. Allostasis is a next step. And we have question number 1. It's good that in the PowerPoint we have question because that's basically reviewing. Which stage of the general adaptation syndrome facilitates the individual's allostatic restoration of homeostasis?
Is it B?
Exactly, it's B, resistance. Okay, resistance and adaptations. If you don't have resistance or adaptation, then we have to the other stage. Okay, and you develop the disease. Stress as a concept, we have exhaustions. In these points, where the body can no longer return to homeostasis, that means in this point we break the equilibrium, we totally break the equilibrium of your body, and then you develop the disease. Okay? Homeostatic overload both of the body organs and tissue for an excessive or ineffectively regulated homeostasis response, effect of wear and tear of the body. So your body is tired, and then you develop the disease. We break the complete equilibrium and all the mechanisms to return to the equilibrium, and now you develop the disease. Stressors. We have aging or condition that can produce stress, dangerous homeostasis. Endangers homeostasis may be external or internal, physical, chemical, biological. Anything that make a change in your body is an stressor. Reaction to stress vary depending upon genetic constitution, gender, past experience, cultural influence, developmental stage, and age. Can include both negatively and positively perceived events. And we have question number 2. Question number 2. Which of the following is an example of an stressor?
Running in the dark?
What?
Is it running
Running in the dark? No. The answer is B. Being exposed to air pollution. Okay? Being exposed to air pollution because it's actually the one that could make a lot of changes in your body, okay? Of course, running in the dark, they may change it in your body, but your body is gonna handle it. It's a normal physiology of your body. You are running in the dark, you are gonna have pupillary dilation, that is accommodation to the light, but that's a normal physiology of your body, normal response physiology of your body. Okay? Using a cell phone sometimes a lot of stress, but we are talking about like medicine. I know that sometimes being in the phone is complicated, but let's keep going. We have risk factor, not stressor, but condition or situation that increase the likelihood of encountering an stressor. Now we have those are the chemical that we produce in our body when we are under stress. Okay. We have the catecholamines. Listen, also you have to know this because I'm pretty sure that you have question about this. Okay. What are catecholamines? This here. So you go straight. Catecholamines, these two. We have more, but you have to memorize these two. Okay, catecholamines, norepinephrine, and epinephrine, or another name is noradrenaline and adrenaline. It's the same, okay? It's only that they change the name. But then they used to use noradrenaline and adrenaline. Nowadays they use norepinephrine and epinephrine. Those are catecholamines. And when you are under sympathetic stimulation is when you secrete those catecholamines, and that produce a lot. Those catecholamines produce a lot of changes in your body. Okay. Now we have a physiology response to the release of catecholamines during the stress response will be. Okay, let me go back for a second. In prosthesis. Okay. This you have to know. I'm assuming from previous class, but the answer is C. Increase glycogenolysis. Okay, so catecholamines they don't decrease, they increase the heart rate. They produce pupillary dilation, not pupillary constriction. They produce increased gastrointestinal motility. They decrease gastrointestinal motility. Okay. They also increase your blood pressure. They have vasoconstrictions. When you have vasoconstriction, then you have increased blood pressure. They increase glycogenolysis. That means that is the production, the destruction of glycogens to produce glucose. Okay. Now we have a neurohormonal mediator of stress and adaptation. We have norepinephrine. Norepinephrine constrict blood vessels and raise blood pressure, reduce gastric secretions, increase night and far visions. Okay, why? Because they produce pupillary dilation. Okay, another name for pupillary dilation is mydriasis. Okay, if you heard mydriasis, that means pupillary dilation. And pupillary constriction is meiosis. It's pupillary constriction. Let's keep going. Epinephrines, they enhance myocardial contractility. That's why they increase the heart rate, increase cardiac output. Of course, cardiac output is related to heart rate because cardiac output is equal. It has a formula. Cardiac output is equal to heart rate times stroke volume. So if you increase heart rate, you increase cardiac output. Causes cause bronchodilations, and though that go inversely inversely, they go opposite. Okay? You have bronchodilations, you increase the heart rate. Okay? That's why sometimes the medication that we use in patients to treat hypertension, like beta blocker reduce the heart rate, but they produce bronchoconstriction. That's why you have to be sometimes careful when you treat hypertension in asthmatic or patient with COPD. Increase the release of glucose from the liver, glycogenolysis. Remember, lysis means destruction of the glycogens. And if you destroy the glycogen, you produce glucose. Adrenocorticosteroids, that's critical to maintain of homeostasis, may synergize or antagonize effect of catecholamines. Example, we have cortisol and aldosterone. Let me see if they explain both right here. Okay, cortisol, one of the main function is to produce glucose, so they increase glucose, affect protein metabolism, promote appetite and food-seeking behavior, have anti-inflammatory effect. Too much cortisol over time can lead to pro-inflammatory effect. Aldosterone, so cortisol is related to glucose. They increase glucose. They could produce diabetes. Aldosterones, they increase blood pressure. Okay, remember that in our body we have the renin, angiotensin, aldosterone system that is in response. That's the response of our body when we have either the blood pressure low, or we have low volume, or we have low volume is equal to low perfusion to the kidney, or if the sodium is low. So in the kidney we have the macula densa. Macula densa, they always sense the perfusion and the level of sodium that is reaching to the kidney. If you have alteration in one of those factors, then you activate the RAS. Okay, the macula densa secrete renin activate angiotensin 2, angiotensin 2 then go to the adrenal glands, and the adrenal glands secrete aldosterone go to the kidney in the convoluted tube of the nephrons, and right there they increase the reabsorption of sodium. And remember that water always follows sodium. If you retain sodium, you retain water, then you increase volume and you increase the blood pressure. Okay, that's the whole physiology of and the function of aldosterone in your body. Let's keep going. Endorphins and enkephalins, that's endogenous opioids, body natural pain reliever. Those are hormones that reduce the pain. Okay, so they raise pain threshold. That means that in order to feel the pain, you need more stimulation, so you need more pain. That's why they reduce the pain in your body. Okay, I have a problem right here.
Professor, are you there? We don't hear you.
Hello, 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 hello.
We can hear you now.
We hear you now, Professor, but it's a little low.
Hospital to treat pains, okay? Um, like chronic pains, okay? And pains that are really, high intensity pains. Let's keep going. Immune cytokines we have secreted by macrophages during stress response, enhance immune system response, prolonged stress can suppress immune functioning. Example is interleukin-1. Sex hormones affect stress response, thus influencing allostasis, may help explain gender response during stress. An example of sex hormone, all those hormones are produced by the adrenal gland, also for other gland, but most of the time for the adrenal gland, estrogen, testosterone, and dihydrotestosterone. Other hormones, we have the growth hormones, can increase during stress to enhance immune functions. Prolactins, similar to a structure of growth hormone, role in immune response. Oxytocin is another one that produced during childbirth and lactation. Prolactin is also produced in lactations associated with bonding and social attachment. To moderate stress response and produce a calming effect. When the patient with female are giving birth, they produce a lot of oxytocin. Because oxytocin, one of the functions is to make contraction of the uterus, and that facilitate the birth process. Individual stress response change with time and circumstance. Effect of stress response influenced by genetics, socioeconomic status, prior susceptibility, pre-existing health status, allostatic stage, ability to manage stress. All those factors are extremely important because it's the one that is gonna change the outcome to be under stress. Then we have adaptations. Adaptation is biopsychological process of change in response to new or altered circumstance, internal or external in origin. Coping is a behavioral adaptive response to a stressor using culturally based coping mechanisms. Adaptation and coping terms used interchangeable. Basically are extremely similar, those two concepts, and distress is a perceived inability to cope with a stressor. That's when you have a lot of stress that you can handle the stress, you are distressed. Adaptation method for stress, we have habituations and desensitization. Desensitizations is biofeedback, visualization, and meditation. Most of the time, desensitization, we use this in medicines. For example, in some psychiatric problems, people that have like phobia, we use the desensitizations. For example, person that have phobia to the high, and then you have to do a therapy that is the desensitization therapy. You get the people put in a second floor, they are exposed to high, then another day in the third floor, another day in the fourth floor, fifth floor, so on, to for the therapy. Okay, allostatic overall, uh, inadequate adaptation mechanism or excessive allostatic load result in inability to maintain homeostasis, lead to various illnesses and disorders, both physical and emotional. Chemical mediator from the stress response contribute to various illnesses, cortisol, catecholamines, cytokines. And right here, there are some PowerPoints that have those case study. In the original PowerPoint, you have all the answers for the case study. Those cases are for all of you to study. Let me